When we become sick, it's easy to mistake our symptoms with the flu. Take meningitis, for example. It causes stiffness, headaches, and a high fever. These symptoms are all very similar to flu-like symptoms, so while to the average person this may seem like a cold or flu, it actually isn't. Due to the assumption, it may not get treated with proper care. Typically, meningitis is triggered by a bacterial or viral fungal infection, and if left untreated, can become life-threatening if the proper antibiotics are not taken. If you suspect that you or someone you know is suffering from meningitis, there will be certain symptoms and signs that will be evident. Before we begin this video, don't forget to become a member of the Bestie universe by subscribing to our channel so that you never miss one of our new videos. Now, keep watching for signs and symptoms of meningitis that every parent should know about. Number 8. Stiffness. Most people suffering from meningitis will experience stiffness in the neck and back because the inflammation spurs from the membranes that cover the brain and spinal cord. It's the constant swelling that causes the discomfort, and if you begin to experience a sudden fever or headache to go along with that pain, you may have meningitis. If you're suffering from a cold, this could develop into what's called viral meningitis. This type of meningitis is not harmful or potentially harmful to your health or others. But if you also have unexplained stiffness in your neck, you should go see a doctor just in case. Stiffness can occur for a number of reasons. For example, you may sleep on it wrong, or you may have held it in an uncomfortable position while watching TV or laying down. If you've ruled out any possible explanations for your muscle stiffness, see if you have any of the other symptoms mentioned in this video. Number 7. Fever. Similar to the flu, the onset of a sudden fever will occur with meningitis as it enters the body. The immune system reacts by increasing the body temperature. If you've developed meningitis, you will experience a fever between 3 to 7 days. Unfortunately, this symptom is not the most common symptom to look out for. According to the American College of Emergency Physicians, only 44% of patients that have this infection will show this sign. This can make self-diagnosing extremely difficult, so if your fever doesn't subside, just keep an eye out for the other symptoms. Number 6. Headache. Another telltale sign of meningitis is a severe headache that will not go away. This is due to the inflammation and swelling in the membranes that are surrounding your neck and spinal cord. Headaches are considered one of the most common symptoms of meningitis. It is important to identify what type of headache you have. Typically, if you have meningitis, the headache you will experience is not the same as the normal headache. It will not subside unless proper meningitis medication is taken. The headache will feel all-consuming, and you probably won't be able to function because of the pain. If you are prone to headaches and are not sure if the headache you're having is caused by meningitis, keep a lookout for any other sudden changes in your health that may signify you're sick. Number 5. Confusion. When your brain experiences severe swelling, it can hinder your ability to function. So, if you're suffering from meningitis, your brain will swell and you may experience confusion, inability to focus, memory loss, insomnia, dizziness, and difficulties waking up. When you're experiencing confusion, it can present itself in many different ways. For instance, you may have trouble discerning what is a dream and what is real. Your memory may not be clear, or you may completely forget certain milestones. If you're having trouble remembering certain things, or just feel like lately your brain has been extremely foggy, you may have meningitis. Number 4. Sensitivity to light. Meningitis can cause severe light sensitivity, which squinting, blurry vision, and difficulty with vision will occur under bright lights or the sun. As a result, you may start to experience a headache because of this. The reason your vision becomes blurry when you're suffering from meningitis is because the optic nerve begins to swell. In most cases, the swelling will go down and your normal vision will be restored. However, in severe cases of meningitis, partial or full blindness can occur in both eyes with no chance at reversal. Number 3. Nausea. If you suffer from meningitis, vomiting and nausea will occur at the early stages. As the infection makes its way through the body, it will upset the stomach and cause vomiting. Often people will lose their appetite as well. Depending on the severity of the infection, extreme weight loss can occur. Those who already have weakened immune systems prior to meningitis are more susceptible to catching the infection. The symptoms they experience may also be much worse because of the body's inability to fight off the infection. Number 2. Rash. Oftentimes, babies and toddlers who experience meningitis will often develop a rash. The rashes appear from the bacteria multiplying into the bloodstream, which releases poisons that begin to damage the blood vessels, resulting in a rash. The best way to test if your rash is just an irritated infection or a cause of meningitis is the glass test. Take a glass and press it up against the area where the rash is. If the marks stay the same, and you can clearly see them through the glass, go see a doctor. But if the marks fade with the pressure of the glass, this is just an irritated rash. Number 1. Loss of appetite. Because of the nausea and constant vomiting, meningitis can affect the digestive system in a big way. You may lose your appetite or even avoid eating altogether because you fear you might vomit it all up. This could lead to an unhealthy weight loss, which can lead to even more health problems. As tough as it may seem, you need to try to consume food when dealing with meningitis. The more nutrients you put in your body, the stronger your immune system will become so it can fight off the infection. In severe cases, people will get admitted to the hospital so they can be put on an intravenous so the patient can stay hydrated. If you notice that you've lost your appetite or just don't want to eat because you feel nauseous when you do it, it's a major warning sign that you may have meningitis. If you've lost your appetite and notice that you're starting to lose weight, it may be time to go to the doctor or the emergency room, especially if you are exhibiting some other symptoms mentioned in this video. Now that you know what signs to look out for that you may have meningitis, here are some ways you can avoid meningitis by living a healthy lifestyle. Get vaccinated. Did you know that there's a vaccine for meningitis? According to Everyday Health, one of the most effective ways to prevent meningitis is to get vaccinated. There are currently 2 vaccines for meningitis available in the United States. The Centers for Disease Control and Prevention recommends that people get vaccinated for meningitis at 11 or 12 years old. They also recommend that teens receive a booster shot for it between the ages of 16 and 18 years old. So, whether you are afraid of needles or not, make sure you get the vaccine if you want to avoid contracting meningitis. Don't share your personal items. You can catch meningitis when you come in contact with respiratory or throat secretions from someone who has meningitis. So don't share personal items with people unless you want to risk getting sick. This includes sharing personal items or kissing. So avoid sharing drinking glasses, straws, water bottles, lipstick, cigarettes, soda cans, and even more. Wash your hands. Viruses and bacteria that cause meningitis can easily get on your hands and travel from your hands to your mouth. Reduce your chances of getting meningitis by washing your hands frequently, especially after being in a crowded place, coughing or blowing your nose, in a bathroom, and even more. Boost your immune system. Keep your immune system strong by eating healthy foods like fruits, whole grains, vegetables, and lean protein. Make sure you get regular exercise and take good care of your health. This can all help boost your immune system and keep you healthy, preventing infections and viruses that can cause meningitis. Living a healthy, active lifestyle, which includes a nutritious diet, can do wonders in preventing sickness and keeping your immune system healthy. So spruce up your diet and your exercise regime and reap the rewards. Have you ever had meningitis? Let us know in the comment section below. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait, what kind of Bestie would we be if we didn't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.